This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. How did the NCLEX used to be set up, and how is it changing to be next gen? And what's a question that was traditional NCLEX question that's now going to be, formed into fitting this new way of setting up questions?
So as of April 1st of 2023, the next generation NCLEX will be launched. And I know they have been doing a lot of beta testing, the National Council of State Boards of Nursing, this spring and in the fall as well in preparation. There will still be some questions that they're going to be beta testing, similar to the previous NCLEX, where there was a minimum of 70 questions, and there was about 10 or 15 of those beta questions.
Sure.
It is similar. So then that minimum is going to be the 70 weighted. So it's still adaptive testing. The test only goes up to, I think it's about 145 questions. It's 5 hours rather than 6 hours. But the types of questions, so there could be up to 3 unfolding case studies, and each case study would have 6 connected questions.
Okay.
And then there are other alternate style questions. There were select all that apply. Previously on the NCLEX, there were dosage calculation questions. Those are going to remain. But one great thing with select all that apply is that the person who tests will receive partial credit on that select all that apply. So that gives them a little bit of an advantage, a little boost, right? There's not just automatically, you answer one answer option incorrect. You have the other ones correct, and it's rather than getting the whole question wrong, that you did get partial credit for that. So that's giving credit to the tester, which is good. There's other alternate style questions, and there's drop downs, there's drag and drops, there are prioritizations, there's these there is bow tie, just kind of putting everything together to really assess their understanding of thinking and what would they do, what would their decisions be when they care for a particular patient. Which I think it's wonderful. And I have to say is that the National Council of State Board of Nursing offers so many resources to those who are testing and those who are teaching, so nurse educators as well as students, that regarding the NCLEX NGM.
Okay. Yeah, I was going to ask, what's the mentality, or what's the perspective from nurse educators? Do they like this change? Is it, intimidating or, what do you and your other professors think about it?
I mean, we appreciate that they are assessing this, and we have we're able to prepare our students for actual patients that they're going to be caring for with these complex needs. And so we really appreciate that, and the need is there. There's just so many uncertainties, we're not sure how, until this exam unfolds and it launches, and we'll see what the results are, and we're excited about it. We think it's a positive thing, and it advances our profession as well.
Yeah. I mean, certainly I think coming out of an era of nursing where nurses didn't feel prepared so much because of COVID, because of, doing things online, changing up this way of teaching to be more critically thinking based, or, simulation, situational case study based. I'm sure that probably helps them feel a little more prepared, I'm sure that's probably a change that was identified in the last couple of years. A problem that was identified that, we have to start focusing towards,
Right. I think that we have a lot of people who need care, and we need really smart nurses. We need safe and good decision makers, and know what to do, and to recognize the early cues of a problem. So we are with them 24/7 in acute care settings and chronic care settings, and we are with them. So we need to see this in our patients.